the extremity needs to be splinted in its normal position. The normal position is defined as, for the arm, like this. For the wrist, like this, slightly elevated. For the hand, like this, as if you're holding a glass of water. And for the leg, with a slight bend, like this. So that's the way that you're going to need to do, put your splint on. Okay, back to trauma. Now there's major trauma. This is divided into blunt traumas. Anybody have any doubt that this is blunt trauma? All right. And this is penetrating traumas. Anybody have any doubt that a set of keys in your eye socket is penetrating trauma? Good. All right. Now penetrating trauma is further divided into perforating trauma. This is Major General Henry Barnum of the U.S. Army, who received, as while a colonel, a mini ball that went directly through his hip. And even 3 years later, after the war, he was still able to put a rod from one end of his hip through the other because of that injury. That injury is a perforating injury. The projectile has gone all the way through the body. This is a non-perforating injury. It looks like a perforating injury. There is a knife in this lady's back, or neck for goodness sake, but it is not a perforating injury because that thing did not go all the way through. It either stays there or it goes out the way it came. And in modern medicine, you are not supposed to, you would come across somebody like this, you are not supposed to remove that knife because you want to get them into a controlled situation where you can remove it and deal with bleeding and other issues that may occur as a result of the removal. In a collapse situation where you are at the end of the line, guess what? You are going to have to just get that person to where you have the bulk of your medical supplies. You're going to have to remove the knife. You're going to, unless they happen to like it there, but that's what you'll have to do. I thought that was a staged photo when I first saw it. I saw the eyes, the look on the faces of those nurses. Gunshot wounds. The most important thing to know with regards to a gunshot wound is there's a guy with a gun out there. My gosh. And that's important because if you are going to be the person responsible for the medical well-being of your survival community in times of trouble, guess what? You're a very important person. You're an asset. You should never put yourself into position, even to help somebody with this type of injury, where you may wind up becoming the next casualty. Okay? Your personal safety is your first and your highest priority. You do your family, your survival community a disservice by becoming the next casualty. Now, standard trauma assessment in the field doesn't necessarily go by the CPR standard. The CPR standard is ABC, and everybody knows that A is for airway, B is for breathing, make sure they're breathing, and C is for circulation. But if you were in a situation in which there was a person with a gun out there, the most likely way that somebody is actually going to die as a result of gunplay is going to be hemorrhage. So I say, call a cab and go. Call out for help first, communicate the situation. Make sure you get as many people available that are going to be able to help you out of this hostile action. 2, abolish all threats. If there's somebody that still has a gun out there, make sure that you are in a situation where you are not going to be in the line of fire. Then circulation. And you check for evidence of bleeding and you stop the bleeding. Then airway, then breathing. Okay? Most of the people that, for standard CPR ABC, you're talking about many times elderly people who have cardiac issues, things like that. Most of the people in this situation are going to have perfectly fine heart and lungs before they got shot. So that's what you do. Also, N, you're going to check their neurological status. In other words, how awake and aware are they? Are they going to be able to help you help them? And then go to wherever your main store of medical supplies are. Now you have to know what type of bleeding is actually going on. There's 2 types of bleeding, arterial and venous bleeding. Venous blood is identified by being dark red, almost black in some cases. And when it comes out of your body from an injury, it flows at a regular rate. Arterial bleeding is bright red because of the high amounts of oxygen in it, and it spurts out in a manner that is commensurate with your pulse rate. So however your heart, whatever your heart is beating at, that's how the blood is coming out, and it's going to spurt out. Supplies for treating wounds include gauze, 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 gauze. If you can improvise by using things like maxi pads, are actually perfectly fine to use. I didn't know you got lilies with every box of maxi pads. Right. Pretty nice. Now, tourniquets. This is a CAT tourniquet, a CAT tourniquet. It's a commercially made tourniquet that's excellent tourniquet. Splints to immobilize injuries after you've managed to stop the bleeding. Of course, gloves, medical tape, your bandage scissors. And this is the Israeli battle dressing marketed in this country as the emergency bandage. And it is a combination gauze, roller gauze, and compression. And it's an excellent item to have in your medical supply.
What about masks?
And of course, you should also have some hemostatic agents. The two most popular brands are C-Lox and Quick Clot. And these either come in a powder that you can pour right on the area, or on the bleeding area, or combat gauze, which you can pack in that happen to be impregnated with all of this powder. And this will stop the bleeding. If you look at the YouTube videos demonstrating the use of these things, you will see that they actually cut the femoral artery of a pig, and they allow it to bleed for a minute or so before they do a thing about it. And then they pour this stuff in there, and the bleeding, and apply pressure, and the bleeding stops. And that's from severing a major vessel.
Is this stuff better choice than a tourniquet?
Is it better than a tourniquet? Let's talk, wait, hold on. No. Wait. Let's talk about that. That's not true. This is what you do. Number one, use your bandage scissors. Cut away the clothing over the bleeding area. 2, put your gloved hand on the wound and apply pressure. First off, don't put your dirty hand on a wound and apply pressure, because you may cause a major infection. Put gloves on as quickly as you can. Put your hand on the wound and apply pressure. Then, get your dressings out from your trauma module or whatever kind of kit that you happen to have, and apply dressings to the bleed with pressure. And then, if it's in an extremity, elevate the wound above the level of the heart. This will slow down the bleeding. And apply pressure. Everything ends with apply pressure. An important thing for you to know is that there are pressure points in the body that will help you stop bleeding at areas that are not necessarily exactly where they are. For example, there's a blood vessel that runs close to the skin right about here. If you have a wound in a bleeding wound, major bleeding wound in your elbow area or your upper forearm, if you press here, you'll slow down bleeding from that wound. On the wrist, on the right side of the wrist, on the outside of the wrist, for any kind of wound on the hand, area on the neck, here for the upper thigh, here for a wound on the femoral artery for a wound above the knee. This is a popliteal artery. This would stop bleeding or slow down bleeding for a wound below the knee. And dorsalis pedis for a wound in the foot. So it's important for you to have a working knowledge of where these pressure points are so that you can effectively deal with the bleeding. Still bleeding despite all this? Then place a tourniquet and continue direct pressure. You wait about 10 minutes, because you don't want to have a tourniquet on for 3 or 4 hours, because number one, it's extraordinarily uncomfortable to have a tourniquet on if anybody's ever put one on. And additionally, when you are stopping the bleeding from an open wound, you're also stopping the circulation to anywhere
below that,
distant from that wound, and you need to have circulation in the area that's working. So you just want to have that pressure until you know you have controlled the bleeding. So I say remove or relax the tourniquet and observe after a period of about 10 minutes. If it is still bleeding, then replace the tourniquet to stop it from bleeding, then remove the dressing. The dressing is probably soaked. Place your quick clot or Celox directly on the bleeding vessel and apply pressure again. Still bleeding? Replace the bandage. And when you, this may be occurring because you are not packing it appropriately. You are to pack into the bleed, not into the wound. What I mean by that is that you might be bleeding. This is a wound, a pretty big wound, would you say? But you might be bleeding from here. This is where the blood vessel has been disrupted and is actively bleeding, maybe not here. So you start with your gauze, packing your gauze right there. And then you fill in the rest of the wound, keeping the pressure on that area. Remember, those gauzes are not just sponges to sop up the wound, they're there to give pressure. You repeat, and then you wait 10 minutes and you relax the tourniquet. It's very, very likely once you've applied your Celox, once you've packed it appropriately, that you will have stopped the bleeding. However, you may have to repeat the process. You may have to rinse and repeat until you're dry. These kinds of wounds are actually wounds that should be left open, pretty clearly from what we talked about before. This is a dummy, but this is a human being, and that's what you can expect it to look like. It's going to accumulate, the dressing is going to accumulate inflammatory fluid, blood clots. It's going to look about like that. That's okay. Now, in a gunshot wound, ordinarily they want to remove the bullet in modern medicine. Unless the bullet is easily accessible, you are not to remove the bullet from the wound. It is okay that it remain there if it has to. We had a president named James Garfield. In 1881, an anarchist shot him in the chest. And it was actually a pretty bad wound, but a wound that he might have survived if he didn't have 12 different doctors poking their hands in the wound trying to pull out the bullet. And so instead, after 30 days of agony, he died. So since we're going to be back to about 1881, if something actually ever happens, otherwise, except for perhaps our knowledge of sanitation and things like that, it's probably important to not remove the bullet in those cases. Then you have to work on keeping that wound. For that wound to heal, it needs a lot of work. So what you're going to do is you're going to irrigate, you're going to squirt water into that area, or betadine, or dilute betadine solution. You want to keep that area clean. The more debris that forms there, the less likely it will heal, the more likely it will become infected. So you want to irrigate it frequently, change dressings frequently, at least 3 or 4 times a day for something like that. And in that kind of wound, you have to give antibiotics. And